Club up, or no? I'm just gonna redo it. Hello, my name is Jake. I'm a nursing student. I'm gonna go ahead and do an assessment on your newborn. Is that okay? Cool. So I'm gonna do hand hygiene. I'm gonna glove up. Off gate. I'm just gonna glove up already. So the first thing I'm gonna do is I'm going to do her vitals. So I'm just gonna listen to her heart rate for 1 minute. So that should be between 110 and 160. And her respirations sound clear. They should be between 30 and 60. And also while I'm listening, I'm just gonna listen to her bowel sounds. They sound active in all 4 quadrants. And I'm going to do her temperature underneath her arm. And that should be between 97.7 and 99.5. After that, I'm gonna go ahead and take off her hat and look for any molding, so elongation sort of out of the head. Notice the suture lines, making sure that they're even. And then maybe some fontanelles to make sure they're soft and flat. And then I would notice for any caput cystatum, which would be the fluid around the head. And then maybe some cephalohematoma, which would be a pronounced elongation on either side of the head, which would indicate bleeding. After that, I'm going to come down to the eyes. So I'm going to check the length or the adjustment, make sure they're all even. So it'll be 1/3, 1/3, 1/3. And then I note for any discharge. Let's see, what was it? Is it epicampal fold for Asians or people with Down syndrome, or the subconjunctival hemorrhage, which would be the bloody eyes or bloodshot eyes. Then make sure it's all lined up with the ears. Check the ears and make sure they have full recoil. They do. Okay, and check the patency of the nose. Cover one nose, one nose. I'm already gloved up, so I'm gonna go down to the mouth, and I'm gonna check the palates to make sure that they're hard and closed. They are, and also check for the sucking reflex, so it should suck on the finger. Then I'm gonna palpate the neck and go from the back to the front. Note for any masses. And also check the range of motion, so the baby would be moving her head around, or if not, I would note that. Check the clavicle to make sure that it's intact. And after that, I'm gonna check the stomach, so there should be like no sinking in of the stomach. It should be round, and once I palpate, there should be no masses or tenderness, and there is not. After that, I'm gonna do a skin assessment, try to keep as covered as possible. So I would note for any rashes, bruising, birthmarks, maybe some stork bites would be on the top of the forehead here, maybe in the neck. The vernix, which would be the white powdery stuff, that may be, and maybe some folds or areas, I would note that if I see any of that. And then also I would check for jaundice, so I would press and blanch the skin on the forehead, the chest, and the abdomen, as well as the thigh. And then also lastly, check the sclera of the eye, note if there's any yellowness or yellow tint to the sclera. After that, I'm going to check the umbilical cord. This baby doesn't have one, but if there was one, I would want to make sure that I keep it dry, and also note any discharge or bleeding. So now I'm going to check the genitalia of the baby, and then this baby is a female, so I would make sure that the labia majora covers the labia minora, and then note if there's any discharge, any bleeding, any white stuff that may be coming out. And then for a male, I would note the presence of the foreskin. I would assess the descended, so I would first place my one finger in the canal, and then the thumb and other finger to feel the scrotum for the descendant of the actual testis, and for both of them, and that would indicate the development of the baby, as well as the rugae would also indicate the development of the baby. I'll close this back up here. nipples. No. So then after that, I'm going to assess the hands and the feet and make sure they have 5, 5, so 10 fingers, 10 toes. And then I would note for any webbing or extra fingers, fused fingers, things like that. And also notice the creasing on the hands and the feet. So it should be 2/3 of the foot would be creased for the newborn. That would indicate a term baby. And then the creasing on the hands should be 2 creases as well, and there is. So now I'm going to turn the baby over and assess the spine. I would note the contour of the spine, which is normal. And I would check the end of the spine for any dimples, troughs, I forget the other one, but that would indicate improper infusion of the spine as well. Okay. So I'm going to bring her back over here. And I could do test the reflexes in a multitude of ways. I could do the Moro, so I could clap, or other ways, but I would clap, and then she would go out in a C shape like that. Or I could do the Babinski's, which would be the J shape at the bottom that would cause the toes to fan out. Or I could do the hand, so come back down into its flexed position, bring it back into its flexed position. So then after that, I would note the emotions of the baby. So this one, baby was very calm and cooperative. Then I would talk with the mother, ask if that baby had had a BM recently or avoided, or when the last time the baby was fed. And I would make sure that the baby was all warmed up, or all warm and wrapped up still.